All right. Hello, everybody. So today is November 20th, 2021. My name is Larry Stewart Zaborski, and I'm here to talk about the skeletal system. The skeletal system, let's go into the main component. It's your bones. The most basic structural unit of the bones is the osteon. You're also going to have osteocytes, which is a mature bone cell. On the bone, you're going to find the osteocytes are going to be in small chambers called lacunae, which are also sandwiched between layers of bone matrix called the lamellae. Within the lacunae, you're going to find the osteocytes, and there's two different types of osteocytes. There's osteoblasts and osteoclasts. Osteoblasts are your bone builders, just like the name suggests. They build your bone. The other one is your osteoclasts, which are your bone breakers. They work in unison, actually. Whenever you kind of recreate and get a new skeletal system, which on average a human gets every 7 to 10 years, the osteoclast will always notify an osteoblast to build more bone before an osteoclast breaks down bone. It's actually a very clever system, which our body does on its own. So within the lamellae, you'll find a central canal, which is where our blood vessels are held. Into the structure of the bone itself, you're going to find your epiphyses, which are the two ends of the bone, and in the middle, where the epiphyses, in between the two epiphyses, you're going to find your diaphyses. In connection with the two epiphyses to the diaphyses, you're going to find your metaphyses. Classifying bone, there's 7 different shapes. So you're going to find your long bones, which is your humerus and your tibia and your fibula. You're going to have short bones, which are your carpal bones in your hand. You're going to have flat bones, like the roof of your skull and your ribs. Next, you're going to have your irregular bones. Your irregular bones are like the vertebrae in your spinal column. Next, you're going to have your sutural bones. These are the bones that are your sutures that are found in your skull. Next, you're going to have your pneumatized bones. Your pneumatized bones, one example is your ethmoid bone in your skull as well. And the last shape is your sesamoid or your sesamoid bone. That is like your patella or your knee. So in essence, all bones are more or less structured the same. They have an outside compact bone and an inside spongy bone. Within the inside spongy bone, you're going to find trabeculae. Also, you're going to find your bone marrow. In the bone marrow, there's 2 different types. You're going to have your red bone marrow, which creates your all your blood cells. Very fitting with the name. Then you're going to also have your yellow, which stores energy as fat. Also very fitting of the color. Going to the skeletal system itself, there's 2 different divisions of the skeleton. You're going to have your axial skeleton, and your appendicular system. I'm going to use my little skeleton right here to kind of show you the 2 different distinctions. So down the middle is you're going to have your axial from the top of your skull down to the bottom of your vertebral column. That is your axial. Everything else is your appendicular. So going to the axial, you're going to have 80 bones in your axial. Starting with the top, you're going to find we're going to go into the skull. Within the skull, you're going to have your cranium. In the cranium, there's 8 bones. You're going to have your frontal right here, your 2 parietals on each side on the top. You're going to have your temporal, also 2 on each side. You're going to have your occipital, which is here on the back. You're going to have your sphenoid. Your sphenoid is right here behind your frontonasal. And your ethnoid. Your ethnoid is slightly inferior to the sphenoid, and so it's going to be right here and behind the eye. Going to the face, you're going to have your 2 maxillae bones right here under the cheekbone, or the zygomatic bones. You're going to have your palatine bones. Your palatine bones are going to be right here. It's going to be slightly inferior to your ethmoid bone. Right in between your nasal bone and your palatine bone, you're going to find your lacrimal bones. Also 2 on each side. I briefly just mentioned the 2 nasal bones. You're going to have your middle nasal concus, and then right under that is your inferior nasal conchi. Right under that, you're going to find this very protruding bone. That is your vomer, or your nasal septum. And the most important bone on the face is your mandible. Also, the one of the only moving bones on your skull. Next, you're going to have is your associated bones, and there are 7 associated bones. You're gonna have 6 in your ear, including the 3 smallest bones in your body, which is your stapes, incus, and your malleus. Then you're gonna find your hyoid. Hyoid's in the back. It is this bone right here, right on top, where it's right above where it begins the vertebral column. Going into that, we're going to go into the vertebral column. There are 26 bones on the vertebral column. You're going to have the top 2 cervical bones, which are the ones that you have to know. It's your atlas, atlas after the Greek god, and your axial. After that, you have your cervical. There's 7 vertebrae in your cervical. There's going to be 12 in your thoracic, and there's going to be 5 in your lumbar. Okay. Underneath the lumbar, you're going to find the sacrum, and the very bottom is your coccyx, which is your tailbone. After that, we're going to have your thoracic cage. This has 25 bones, including 1 is your sternum, which is right here. You're going to have 24 ribs. Now, there's 12 pairs of ribs. Pairs 1 through 7 are called your true ribs, or your vertebral sternal ribs. And this is because they're actually connected to the sternum. Pairs 8 through 10 are called false ribs. They are also called vertebral chondral because they're not directly connected to the sternum. Your last 2 pairs are right here, 11 and 12, and they're your floating ribs. They're actually not connected to anything other than the spine. Otherwise that's spine. So that kind of covers the whole axial skeleton, and we're going to go into the appendicular skeleton. Starting off with the pectoral girdle, you have your 4 bones. Your pectoral girdle, you're going to have your 4 bones, your 2 clavicles right on each side, right here in the front, and your 2 scapula, or your wings, on the very back. Going into the upper limbs, you have both arms. The biggest bone in your arm is the humerus. I'm going to use this tool. You have your humerus. Going into the forearm, you have your radius, which is on your thumb side, and your ulna on your pinky side. Great way to remember that is when you're checking a pulse, when you're becoming a doctor, you're going to check your radial pulse. It's always going to be on the side of your thumb. That is where your radius is. Very good way to remember it. Going into the carpal bones, which is your wrist, you're going to find 16 or 8 on each hand, and they're divided into 2 sections of carpal bones. You're going to have your proximal bones, which is your scaphoid, your lunate, your tricuspidum, and your pisiform. Then goes into your distal. You're going to have your trapezium. I'm going in order from lateral of the thumb outwards. So it's going to be trapezium, trapezoid, capitate, and hamate. Then going into your metacarpals, which is in between your wrist and your phalanges or your fingers. They're all labeled 1 through 5, 5 on each hand. Also starting from laterally on the thumb, going to the 5th phalange. They're labeled 1 through 5 in Roman numerals. Then you can have your 5 phalanges. Each phalange has 3 different bones. It's going to be your distal, your proximal, and your middle phalanx. Other than the thumb is only going to have 2, being 28 on each hand. Further down, we're going to go into the pelvic girdle. Pelvic girdle has 2 hip bones, 1 on each side. Lower limbs. Biggest bone in the body is your femur. Then we're going to go into the tibia, the monster, and then the fibia. Very similar to the hand. You're going to have your ankle or your tarsal. There's only 14 bones, 7 on each side, and they're going to be classified as the talus, the calcaneus, the cuboid, the navicular, and then there's going to be 3 cuneiform bones: medial cuneiform, intermediate cuneiform, and the lateral cuneiform. Then you're going to have your metatarsal, very similar to your hand, labeled 1 through 5 Roman numeral, starting actually medially with the big toe and then going out laterally to the pinky. Phalanges are are exactly the same, except the medial big toe has only 2 phalanxes, and every other phalange has 3 phalanxes. I'm going to put him down. And the last part of the skeletal system are your joints. Your joints are junctions between 2 or more bones, and they're classified in one of 3 joints. You have your synarthrosis, which are your immovable joints, like your sutures in your skull. You have your amphiarthrosis, which are slightly movable, like your pelvic girdle, and your diarthrosis, which are freely movable, which are most of the joints in your body. And that is the anatomical classification. So now we're going to go into the structural classification. You have your fibrous joints, which is when they connect bone with fibrous connective tissue, just like the name suggests. Those don't move at all. You have your cartilaginous joints, which connect bones with cartilage, just like the name suggests. Also, don't really move too much. And last but not least, you have your synovial joints. Synovial joints are freely moving, like most of the joints in your body, and they're classified into 6 different types of synovial joints. You have your plane joint, you have your pivot joint, you have your saddle joint, your hinge joint, condylar joint, and the ball and socket joint. So that's for the most part what the joints are. And then there's one out of the many different types of clinical applications that you can find when you become a medical professional in terms of knowledge of the skeletal system. Very simply, anytime your patient breaks any bones or fractures or sprains anything, you absolutely need to know the anatomy of the body, because you need to determine the severity. The severity will also determine the treatment plan. It will determine how the degree of urgency that you need to see this patient to medical treatment. A lot of it has to go into can it protrude into other organs. The anatomy of the skeletal system is very, very important in treating any type of patient, whether it be physical trauma or internal trauma. You won't even know unless you know the anatomy of the skeletal system very well. Thank you for listening. I hope it was informative. Have a good one.